Hi everybody, I'm Sue McLaughlin. I'm a registered dietitian, nutritionist, and certified diabetes educator that works here in Winnebago. And I am providing this particular topic along with my colleague Mary Kelsey. And as you know, we have done a number of different presentations to Educator parents. And so this particular topic is on how to help balance your kids' screen time along with exercise, which this presentation Mary and I did about a year and a half ago, and actually it was thus pre-COVID. So we know that there have been a lot of adjustments in our family lives and the time that we're spending related to COVID. So some of the things that I'm going to talk about first come from the American Academy of Pediatrics, and their recommendations were based on, again, research that had been done back in 2017. So I'm going to share that information first and then have some recommendations that we all can use when we're working with our kids and our grandkids. So did you know that 73% of 2 to 4-year-olds watch TV every day? That 5 to 8-year-old children watch an average of 3 hours of TV per day? And that we find that when a child has a TV in their bedroom, then they are also not only more likely to watch that TV, but also they find when they look at growth patterns that children that have TVs in the bedroom also have increased challenges with weight gain, so their weight is getting ahead of their height. And 44% of 2 to 4-year-olds actually do have TVs in their bedroom. They also found through research that for every hour increase in watching TV, 3-year-olds also consumed more sugar-sweetened beverages, fast food, and red and processed meats, all things that we know are less healthy for them and their growth. They also found that they had more calories taken in, and that more of their calories came from something called trans fats. Trans fats have pretty much been taken out a lot of our food products, but they still exist in some snack foods, and they actually have been shown to not be heart healthy. So again, that TV watching, especially in the bedroom, can be problematic. They also found that when children are eating more of those types of foods, they also at the same time tend to consume less fruits and veggies and the nutrient calcium, less dairy products in other words, and they tend to then consume less fiber. So basically, one of the things that we want to look at is overall where are kids spending their time and how much of it are they spending in the bedroom, for example, or in spaces that limit the amount of activity that they have in their day. The research for the American Academy of Pediatrics also found that when children are getting more screen time or the quality of that screen time is not as healthy for them, they also lack social skills in working with other kids. They also found that they may have more behavioral problems, also more acting out, and then their sleep patterns are also irregular, and actually they sleep less, which, you know, when children are growing, they actually need more time for sleep to help them grow as they were meant to grow. They also find that there is a link between use of smartphones and devices and an increase in depression. So all of that, especially during this past year or so with COVID, makes us more worried about that for them. But what we want to look at is what we can do given the current situation. So what the Academy of Pediatrics has recommended is that we do as best as we can to limit TV and screen exposure to less than 2 hours per day, that we try to help them avoid commercials and advertisements because those are the things that tend to also suggest eating many foods that are not healthy for them. They also recommend that we keep the TVs out of our kids' bedrooms and that we avoid snacking while watching TV, or even if that is not realistic for your family, to have snacks available that are going to be healthy. So maybe more, carrot and celery sticks. If they like something sweet, having more fruits or having more, perhaps even diet Jell-O, having something like popcorn or some type of a granola type product that they can eat. Also, Mary just finished a video on using the air fryer and making bananas that have a lot of healthy things on top of them, and that would be a great choice for kids to have as a snack. So some of the things that you can think about when you're trying to help move your child in the right direction with screen time are how much time does that child actually use during the day, and kind of quantifying that. So are they using, their phone for 2 hours? Are they watching TV for 2 hours? Are they using an iPad for a period of time? And there's actually a handout that you have with this presentation that gives you some different options for what you could use to quantify what your child or grandchild is using. Another important thing to think about is who's making decisions for them. Have we set some guidelines so that they can associate how much time they are spending on screen time and how much time they're active during the day? What types of snacks are they eating? And what types of snacks or meals are the rest of us in the family eating? And because we want to be sure that we are role modeling healthy choices for them. So in sum, we do know that there's research to support that increased screen time can lead to less healthy activities for kids, more increased choices of foods that are not going to help them grow as much as they are meant to, and also increased weight gain. And so if there's a way that you can help to give some guidance to your children, maybe first step would be to just see how much they're doing on the different devices, and then really aim toward less than 2 hours a day on watching things that are not educational, and then tying that with time outside. And now that the weather's better, really encouraging them to be out, to take walks with them, to do whatever you can to help them understand that being healthy is a normal, healthy role in our lifestyle, so that they establish those habits as they grow. Look forward to seeing you in the community. Look forward to seeing you at the farmers market. Please stop by there. I'll be there at least one Saturday a month providing some nutrition tips, and we hope to have some cooking demonstrations at that same time. So look forward to seeing you then. Thanks so much.